Welcome to our video on the anatomy of stress. We will be exploring the 6 dimensions of systemic overload to better understand how stress impacts us. Stress is not just a mental state. It triggers a fight or flight response, causing chronic flooding of cortisol and adrenaline, and putting the body in emergency mode. It manifests across every dimension of human experience. Stress creates an inside-out ripple effect. A breakdown in one dimension, such as physical or emotional, inevitably ripples into the others, including cognitive, behavioral, interpersonal, and spiritual. Dimension 1 is physical, focusing on the bodily manifestations of an overstimulated nervous system. These include frequent headaches, muscle tension, a rapid heartbeat, digestive issues, and a weakened immune system. Dimension 2 is emotional, covering subjective feelings and mood states when a person is overwhelmed. This can lead to constant irritability, agitation, inability to relax, a sense of loneliness, and general unhappiness. Dimension 3 is cognitive, involving the disruption of thought processes, memory, and the ability to focus. Symptoms include inability to concentrate, brain fog, constant worrying, and pessimism. Dimension 4 is behavioral, relating to outward actions or habits adopted as coping mechanisms. Examples are changes in appetite, increased use of alcohol or nicotine, procrastination, nail biting, and social withdrawal. Dimension 5 is interpersonal, focusing on the strain stress places on relationships and social interactions. This includes frequent arguing, losing interest in intimacy, becoming defensive, and lashing out at others. Dimension 6 is spiritual, which manifests as a crisis of belief or a feeling of emptiness regarding one's place in life. This can result in hopelessness, loss of direction, or questioning one's values and efforts. The symptom loop shows how isolated symptoms trigger systemic cascades. For example, a cognitive trigger like worrying can lead to a physical reaction, which informs a behavioral coping mechanism, impacting interpersonal relations and feeding the loop. This diagnostics matrix summarizes the 6 dimensions, their primary focus, and key examples of stress symptoms across the physical, emotional, cognitive, behavioral, interpersonal, and spiritual categories. Effective recovery requires treating the entire system, not just the symptom, because stress operates as a multidimensional loop. Recognizing these dimensions is the first step toward breaking the cycle.